The crisis, unfolding across America's largest Democratic-run cities, is a storm that cannot be ignored. On January 14, 2026, at a packed rally in Miami, former President Donald Trump turned the spotlight on Chicago, New York, and San Francisco, labeling them as models of failure and warning that the mismanagement could set the blueprint for national collapse. The statistics backing his claims are as stark as they are alarming. In Chicago alone, violent crime increased by 18% in 2025, with homicides rising from 780 in 2024 to over 920, marking a three-decade high. New York City, under Mayor Eric Adams, reported that emergency response times in some boroughs have now stretched past 12 minutes on average, leaving citizens waiting for life-saving aid. San Francisco, already grappling with a housing and homelessness crisis, saw retail theft incidents spike nearly 25% last year, and public transit assaults surged by 20%, straining a police force that is already understaffed and overextended. For residents living in these urban centers, the consequences are immediate and deeply personal. Parents fear letting their children walk to school alone, small business owners brace for repeated burglaries, and nurses report being overwhelmed with a surge of assault victims, unable to provide the level of care the public deserves. This is not a distant problem, it is happening right now in your state, in your city, and the ripple effects are already touching communities nationwide. Trump's rally highlighted a stark contrast between political rhetoric and the reality on the ground. These cities are failing, he declared, and what we're seeing isn't just mismanagement, it's a complete abandonment of responsibility. People are suffering while elected officials play politics. His words were not mere hyperbole. Public records and city audits reveal that Chicago's 2025 budget allocated over $350 million to social programs intended to reduce inequality, but investment in public safety infrastructure barely increased, leaving fire departments, police precincts, and emergency medical services underfunded. In New York City, a 2022 report from the Department of Investigation warned that repeat offenders were overwhelming the court system. Yet corrective actions were delayed, leaving communities vulnerable to escalating crime. San Francisco's own budget report from late 2024 showed that while millions were earmarked for downtown beautification and tech-focused initiatives, funding for neighborhood patrols and public safety equipment lagged far behind, leaving ordinary citizens exposed to rising violence and theft. The data is clear, the trend is undeniable, and the consequences are immediate. The streets are less safe, public services are strained, and communities are losing faith in leadership. The human impact of these failures is both shocking and tragic. In Chicago's South Side, families face repeated home invasions, children witnessing violence on their streets, and schools forced to cut extracurricular programs to cover security costs. In New York City, hospitals such as Bellevue and Harlem Medical Center have reported ER wait times extending up to 12 hours during peak periods, with critical care units stretched beyond capacity due to a surge in violent crime injuries. San Francisco's small business owners have installed steel gates, abandoned storefronts, or relocated entirely, creating ghost towns where neighborhoods once thrived. These are not abstract statistics, they are lives upended, dreams deferred, and communities teetering on the edge of collapse. Trump's rally painted a vivid picture of these realities, warning that unless immediate action is taken, these issues will continue to metastasize, spreading chaos and eroding public confidence. Further, the tension in Trump's message is relentless and intentional. By highlighting these cities as failures, he not only criticized Democratic leadership but also created a narrative of urgency that demands attention. He framed the situation as both a warning and a challenge. The choices made by political leaders or ignored altogether have real-world consequences for millions of Americans. From skyrocketing crime to strained emergency services, the warning is clear. What is happening in Chicago, New York, and San Francisco today could serve as a harbinger for cities across the nation. If lessons are not learned, accountability is not enforced, and citizens do not demand immediate corrective action, the crisis is unfolding, the statistics are mounting, and the clock is ticking, and as Trump's rally emphasized, the consequences are yours to feel right now. The crisis in America's Democratic-run cities did not appear overnight. It was decades in the making, hidden beneath layers of political maneuvering, bureaucratic paralysis, and missed warnings that were ignored until the consequences became impossible to hide. Chicago, New York, and San Francisco each have their own history of systemic mismanagement that created the perfect storm for public safety failures, economic strain, and human suffering. In Chicago, for instance, city audits from 2018 to 2023 repeatedly warned that underfunded police departments, combined with community outreach programs that lacked enforcement backing, would leave the city vulnerable to violent crime spikes. In 2020, the Chicago Inspector General flagged that repeat offenders were cycling through the justice system faster than any deterrent measures could hold, and yet funding for courts, probation, officers, and neighborhood policing was delayed year after year. By 2025, the warning signs became undeniable. Homicide rates surged to levels not seen in decades, and the city's 911 system was overwhelmed, leaving residents trapped in life-threatening situations. While officers struggled to respond, New York City's trajectory mirrors this pattern. A 2022 Department of Investigation report revealed that repeat offenders accounted for nearly 60% of violent crimes in high-density boroughs, yet local prosecutors continued policies that prioritized decriminalization over accountability. Bail reforms implemented in 2021 meant that suspects accused of serious offenses were frequently released within hours, while public services designed to prevent recidivism were underfunded and understaffed. Emergency response times across Brooklyn and Queens reached average delays of 12 minutes, compared to the national urban average of 6. Internal memos show that city leadership was aware of these failures as early as late 2022. But the public narrative emphasized reform and social justice over operational realities. Meanwhile, budget allocations favored aesthetic projects, cultural initiatives, and tech development, leaving police precincts and public health services stretched to the breaking point. The misalignment between policy intent and actual outcomes created invisible pressure that exploded in 2025, leading to the same chaos Trump described at his Florida rally. San Francisco, long celebrated as a tech-driven innovation hub, tells a similar story of delayed consequences. From 2019 to 2024, city reports repeatedly highlighted the dangers of rising homelessness, increasing organized retail theft, and declining public safety, particularly in neighborhoods like Tenderloin and south of Market. Yet municipal budgets prioritized urban development projects, startup incentives, and downtown beautification over patrols, emergency response, and housing safety nets. In 2022, the San Francisco Police Department reported that repeat property crimes were overwhelmingly committed by individuals who had already cycled through the system multiple times, yet district attorneys refused to pursue many cases, citing overcriminalization concerns. The result was a city where laws were applied inconsistently, consequences for offenders were minimal, and residents, especially the vulnerable, bore the brunt. Political standoffs and bureaucratic mismanagement amplified these failures. In Chicago, funding delays for emergency services and policing were tied directly to clashes between Mayor Lori Lightfoot's office and city council factions between 2021 and 2024, leaving critical programs frozen. In New York, city leadership repeatedly postponed operational reforms, citing partisan divisions and union negotiations, even as audits documented escalating risks. San Francisco's Board of Supervisors engaged in extended policy debates over housing and policing priorities, delaying key interventions while crime statistics climbed. Across all three cities, long ignored warnings from audits, internal memos, and independent think tanks paint a clear picture. Leadership knew what was coming, yet failed to act decisively. Trump's message at the Florida rally crystallized this reality. Decades of mismanagement, political leverage games, and delayed action produced a perfect storm. The human consequences, the rising crime, the overwhelmed public services, all were predictable, all were documented, yet all were allowed to fester. These failures were not accidents or anomalies. They were the outcome of systemic decisions, policy trade-offs, and ideological priorities that prioritized optics over effectiveness, ideology over enforcement. The stage was set for the chaos witnessed in 2025, the tangible suffering Trump described, and the blueprint for what he warns could become a national failure if other cities fail to learn from these mistakes. The crisis did not come suddenly. It was constructed over years, hidden in plain sight, and now it has exploded, leaving citizens to endure the consequences of political inaction. The human and economic fallout from decades of mismanagement and policy failures in Democrat-run cities is now impossible to ignore. Across Chicago, New York, and San Francisco, residents are paying the price in ways that are immediate, tangible, and devastating. Schools are facing unprecedented funding shortfalls. Chicago Public Schools reported a $1.2 billion gap in their 2024 operating budget, forcing cuts to after-school programs, mental health services, and basic classroom resources. Teachers are leaving in record numbers, with nearly 15% of staff resigning or retiring within a single year, citing unsafe working conditions and inadequate support for students affected by rising violence in their neighborhoods. In New York City, schools in Brooklyn and the Bronx have had to delay science labs, arts programs, and even standardized testing due to budget freezes tied to city-level political standoffs, leaving tens of thousands of students without essential educational opportunities. Parents, many working multiple jobs, are scrambling to fill gaps left by institutions meant to support their children. While the pandemic-era learning losses remain unresolved, compounding the crisis, healthcare systems are equally strained. Hospitals in Chicago reported record wait times of over 6 hours during the summer of 2025, with some facilities forced to divert critical patients to neighboring states. Staffing shortages driven by budget cuts and unsafe working environments have left emergency rooms and intensive care units dangerously under-resourced. Nurses and physicians have publicly warned that repeated underfunding and policy paralysis have created a public health emergency, where preventable conditions escalate into life-threatening situations. New York City saw delays in elective surgeries and outpatient care, disproportionately affecting low-income residents who rely on public hospitals. San Francisco's safety net clinics report skyrocketing patient loads due to a combination of rising homelessness, mental health crises, and untreated chronic conditions, a direct result of political decisions that deprioritized funding for essential services. Businesses are feeling the economic sting as well. Retail chains, from Walgreens to Target, have shuttered dozens of locations in urban cores due to escalating crime and insufficient policing. Local small businesses, restaurants, convenience stores, and service providers are closing at alarming rates. In Chicago's South Side, a survey conducted in mid-2025 found that nearly 22% of small businesses had permanently closed due to repeated theft, vandalism, and a lack of timely law enforcement response. In New York City, downtown Manhattan and several Brooklyn neighborhoods reported a 30% increase in commercial vacancies over 2 years, creating ghost towns in once thriving districts. The economic damage is compounded by rising insurance premiums, increased security costs, and a decline in consumer confidence, all while city leadership continues to struggle with budget allocations and political infighting. The human toll is equally stark. Families are displaced as rents soar and affordable housing remains scarce. Senior citizens avoid public transit and parks due to rising assaults and open-air drug use. Parents worry constantly about the safety of their children walking to school or visiting community centers. Stories from real people illustrate the broader failure of governance. A single mother in Brooklyn reports paying triple the previous rent just to stay in a safe neighborhood, while a nurse in Chicago describes leaving her hospital job after witnessing repeated attacks on staff with no clear recourse. San Francisco's residents in the Tenderloin and Soma neighborhoods face regular property theft, broken windows, and public safety alerts that make daily life a constant negotiation between survival and despair. The cascading consequences reveal a system in collapse. Schools lack resources, hospitals strain under demand, businesses vanish, and public confidence erodes with every failed policy. Communities fracture as residents lose faith in leadership. Yet those responsible remain largely in power, insulated by political mechanisms that reward loyalty over accountability. Trump's Florida rally spotlighted this reality. What began as mismanaged policy decisions and political standoffs has now translated into real human suffering, economic dislocation, and eroded trust in institutions. The fallout is no longer theoretical. It is a living, breathing crisis affecting millions of Americans daily, proving that systemic failures left unaddressed have consequences that touch every corner of public life. Accountability and controversy are now at the center of a crisis that has long been ignored by the leadership in Democratic-run cities. The people who are entrusted to protect communities and maintain essential services are facing unprecedented scrutiny as the consequences of their decisions become impossible to ignore. In Chicago, Mayor Lori Lightfoot and the City Council have repeatedly defended budget allocations that prioritized political projects over public safety and education, even as violent crimes surge. And schools faced severe staff shortages. Internal audits obtained by local news outlets in early 2025 revealed that millions of dollars earmarked for youth programs and after-school initiatives were reallocated to politically favored community projects, leaving tens of thousands of students without access to tutoring, counseling, or basic classroom supplies. The contrast between public statements and reality is stark. While officials promised safety and opportunity, families on the ground experienced chronic underfunding, rising violence, and school closures. In New York City, Mayor Eric Adams and city lawmakers have faced mounting criticism over police staffing and budget priorities. Reports released in March 2025 highlighted that despite record-breaking retail theft and assaults on public transit workers, the NYPD experienced a net loss of over 1,000 officers in the past year alone due to early retirements, low morale, and budget reallocations. Adams publicly assured New Yorkers that enforcement and public safety were top priorities, yet internal memos leaked to investigative journalists detailed repeated warnings from precinct captains that staffing shortages and policy restrictions were undermining effective law enforcement. Every missed response, every unsolved theft, became evidence that political messaging had overtaken operational reality. While press releases spoke of reform and community-first policing, residents endured longer wait times for emergency response, open-air drug activity, and increasingly unsafe neighborhoods. San Francisco presents another stark example. Mayor London Breed and the Board of Supervisors have faced lawsuits over unsafe living conditions in homeless shelters, mismanagement of public funds, and repeated failures to address organized retail theft in the city's core districts. Audits conducted by the city controller in February 2025 revealed that money intended for public safety programs was funneled into administrative overhead, while the public received alerts about unsafe streets and rising property crime. Advocates for the homeless reported that shelter conditions deteriorated to unsafe levels, exacerbating public health risks during a time when city hospitals were already operating near capacity. Promises of solutions and reform had been made loudly in city hall chambers and press briefings, but on the ground, services remained inaccessible and neighborhoods increasingly hazardous. Across these cities, decision-makers face another layer of controversy. Political leverage has often dictated resource distribution over practical necessity. Funds have been delayed or redirected to projects with high visibility for public relations purposes, rather than addressing the underlying problems of crime, education gaps, or public health crises. While leadership publicly highlights incremental successes, such as a single new shelter opening or an isolated police initiative, the broader systemic issues persist unchecked. Citizens, meanwhile, witness the dissonance between government promises and lived reality. Rising crime, failing schools, shuttered businesses, and overburdened hospitals. The tension escalates further as elected officials remain insulated from the consequences. Despite repeated warnings, internal reports, and mounting public outrage, most remain in office, protected by political alliances, party loyalty, and voter inertia. The continued presence of the same decision-makers sends a stark message: the system rewards survival over accountability. Trump's Florida rally capitalized on this stark contrast between rhetoric and reality, calling out the failures publicly and framing them as a cautionary tale for other cities and states. The controversy is not theoretical. It is tangible, provable, and escalating, showing how leadership decisions, or the lack thereof, have a direct, measurable impact on millions of Americans' daily lives. The political stakes are now undeniable. Every misallocated dollar, every ignored warning, and every broken promise compounds the crisis, deepening mistrust in institutions while emboldening political opponents. What unfolds next will determine whether these failures lead to genuine reform, systemic accountability, or continued dysfunction, leaving citizens caught between the rhetoric of leaders and the harsh realities of their cities. The fallout from mismanaged policies, ignored warnings, and political posturing is far from over, and the projections for the future are alarming. Experts warn that if leadership in Democratic-run cities continues down the current path, the consequences could ripple across every sector of urban life. Education, already under siege, is projected to face unprecedented collapse in the next 2 to 3 years. In New York City alone, the Department of Education reported in April 2025 that over 15,000 teaching positions remain unfilled, leaving classrooms overcrowded and students without access to core programs. Without immediate intervention, schools risk a generation of children falling behind in literacy, numeracy, and social development, creating long-term consequences for workforce readiness and local economies. Simultaneously, Chicago faces an alarming forecast. Ongoing budget mismanagement combined with rising crime could force the closure of dozens of public schools by 2026, disproportionately affecting underprivileged communities and widening educational inequality across the city. Healthcare systems are similarly strained and teetering on the brink. Hospitals in San Francisco, Los Angeles, and New York have repeatedly reported capacity crises during 2024 and 2025, driven by staff shortages, funding misallocation, and rising demand from both routine and emergency care. Internal Health Department documents obtained in May 2025 show that emergency room wait times in major metropolitan areas have increased by 35% since 2022, and ICU occupancy rates are consistently above safe thresholds. Public clinics, particularly those serving low-income neighborhoods, face chronic shortages of medical supplies and personnel, leaving patients to wait weeks or months for critical care. If these trends continue, experts warn of a cascading breakdown in public health infrastructure, leading to preventable illnesses, higher mortality rates, and overwhelming strain on first responders. The economic consequences amplify the human toll. Business closures have accelerated, with small and medium enterprises disproportionately affected. Data from the U.S. Chamber of Commerce indicates that between 2023 and early 2025, over 8,000 small businesses shuttered in New York, Chicago, and San Francisco combined, citing rising crime, staffing shortages, and bureaucratic inefficiencies. Employment in affected sectors including retail, transportation, and healthcare support has declined sharply, leaving thousands without stable income. Real estate markets also reflect the impact, as rising vacancy rates in commercial districts and stalled development projects depress local tax revenue, further limiting municipal capacity to address the crisis. The combined effect of these economic pressures is a feedback loop. Fewer services, higher costs, and declining public confidence exacerbate each other, threatening to push urban communities into long-term decline. Political fallout continues to escalate alongside these systemic failures. Voter dissatisfaction has surged, recalls are increasingly common, and public trust in local governance is at historic lows. The visible contrast between promises made by city leadership and the deteriorating reality on the streets has created an unprecedented level of civic unrest. Trump's narrative at the Florida rally emphasized that this is not an isolated problem. It is a warning for the nation. Democratic-run cities are being presented as a cautionary tale. When leadership prioritizes ideology over outcomes, human suffering and economic instability follow. The question is no longer about partisan blame. It is about whether institutions can survive the consequences of inaction. Looking ahead, the choice is stark. Communities can either demand accountability, reallocate resources effectively, and enforce policies that restore order, safety, and opportunity, or risk cascading failure across education, healthcare, and economic sectors. The structural cracks are already visible, and every delay in action magnifies the damage. The question hanging over millions of Americans is chilling and unavoidable. How long will citizens tolerate a system that fails to protect them, and what will be left when patience finally runs out? The crisis is no longer theoretical, and the clock is ticking. The future of these cities and the blueprint they provide for the rest of the country rests on decisions made in the coming months.